Hello everyone, and welcome to another episode in our afternoon cake series. And I'm super excited today to welcome here with me Istvan Petak. He's the founder and director of the science part of Oncompass medicine. You wonder what this is about. Well, he will be talking to you more, but just to give you a brief example, he has been working in this field for many years, published hundreds of articles. And the cool thing about Oncompass, what he's doing now, it's focusing with the AI on cancer treatment to really change that, like how you would get treated for cancer. And they are crunching all the data for cancer, all the biological rules, mutations based on the DNA sample, and they have been recognized by the global startup competition just recently, ranking on the top of 25,000 startups, I see. So this is super competitive, where they are like showing the way. They also received the Future Unicorn Award, and just recognized also by Digital Europe in 2021. And the best part, it's not just the words. They products, even right now, they have saved the lives of thousands of cancer patients until now, and I hope many, many millions in the years to come. So welcome to the show, Istvan Petak.
Yes, thank you very much. Thank you very much, Timo, for your kind words and introduction, and Beata for inviting me. I'm really happy to be here. I would like to also greet the audience. I don't see you, but I hope you see me, and we can connect the ideas and spread ideas. This is great. And this is the beautiful thing about science and technology, that we humans are all together developing tools to make our lives better, conquer diseases. So I always think about technologies as the modern tools. We just call it now technology is a fancy word for a tool, but we humans, we use tools to enhance our abilities. We can breathe under the water, or we can go to the moon with rockets, we can fly with all the tools, and we have microscopes to enhance our ability of eyes to see things which otherwise we would not see. And if you think about it, all these tools, technologies are developed by technology companies. So that's the other thing is common and shared. So of course, academic research is very important to explore the unknown, but to give tools like this computer we are using now to communicate right now, and even my jacket and shirt is everything is produced by technology companies and companies, and also, but we see a great shift also in medicine, where the research is more and more it's happening in technology companies. So they lead humanity to Mars, and also to lead us to find new ways to treat diseases. And so that's why I'm so excited about it, because originally I was always, as a kid, wanted to be a scientist, a biologist, and at the beginning I was trying to keep alive a turtle, the tortoise, actually. That was the important when I was 12. And the debate was that whether it's a turtle or tortoise, whether it's a land turtle or a water, and what to feed. And then I had to go to the library at the age of 12 and borrow a book about animals and learn the Latin name of the animal. And then when I found out what that this particular animal eats, I could save the life of save a life with knowledge. And that's why I went to this medical school. And then, so I'm an MD, PhD, so I graduated as an MD. And then I started to work at the pediatric oncology department and to try to treat children with cancer, but I could see that many of those failed to respond to current therapies, and we knew that there were some differences at the molecular level between individual cancers, but we still had to give the same chemo to everyone, and we had just hopelessly see how they die, and this was terrible. So therefore I decided to go to research, and this is how I want to do molecular pharmacology, molecular pathology, to figure out how genetic alteration regulates cell death, the sensitivity to therapies, and find new ways to treat these patients. And this is how our journey started. But as a doctor, I always wanted to develop tools for other doctors to help them to be more successful treating patients.
Well, this is super interesting story. I think I like what you said, that you know, how you were like helping the tortoise using knowledge to save lives, and I think what was also very interesting was that you know, that you were working over there with the children dying in cancer, but seeing that certain technologies fail. And I think one of the biggest struggle I have heard in healthcare is that, you know, you have, you know, some tools and methods that were used in past, but then when there is something new invented to kind of push that innovation. I think even like a few hundred years ago, when they discovered that, you know, the doctors actually should wash hands, not to kill patients, it was like, you know, very hard to bring this into a real habit. So I'm wondering, like, maybe you talk about a bit more how you started Oncompass and how you actually changing the lives and changing the mentality of the doctors and care providers to use your service. Because like sometimes I was reading somewhere that only like 17% of healthcare innovations managed to, you know, get to the market and be used. That how you have managed to kind of penetrate into the success through this very, I would say, conservative field of medicine.
Yes. Yes, it's true. It's amazed that you know this number, this 17%. I would be extremely curious about the source, because this is something a very interesting number, so we can talk it about later. But yes, medicine is extremely conservative. Actually, this is actually why the digital transformation is happening only now, because few years ago, like I was talking to a patient who visited me, and we were laughing because she said that she was coming to my office using, of course, Google Maps, but bringing all the medical records printed out and reading. So I mean, it's just bizarre that that medicine was lagging so behind using new technology. So that's really bad. And it's actually very painful in case of cancer research and oncology, because this is a battlefield. So any disease which is incurable with today's technologies actually requires our instant innovation, and always we have to, it's actually an ethical obligation to find new ways to treat these patients, for example, to refer them to clinical trials and try new things by definition. So that's why I like oncology, because this is where research and technology and clinical care actually meets. They're actually close together. And so actually this lady died. So it's actually, it's tragic that because she died because she had a double biopsy from her breast cancer, and one was negative and one was positive for EGR2, the most common gene routinely tested in breast cancer. But the doctor missed the information of the second biopsy. So the doctor didn't give any targeted therapy, which was available. And so she had a metastatic disease she shouldn't have. and she died after that. So that's really burned into my memory, that it can, and to also always remember me that it cannot happen again. So what's happening is that in our new current IT system, all results are uploaded automatically from the labs, and this system always reminds the doctor to take into consideration all reports. So it's not the human who is allowed to, who has to remember to take into consideration all the reports, but it's automatic, of course. So, but this is just the beginning of the transformation. So just few words how it all started, because yes, I was a researcher, and then I went to, but I saw the unmet need. And I love this expression, unmet need. It's actually is a biotech buzzword, but I love it. I love it. So this is what we're looking for. If you want to start a health tech company, you have to find your unmet need in medicine, and you have to the problem you want to solve. And so I went to, but first I went to research, and I went to the United States, to the St. Jude Children's Research Hospital, which is the fantastic place in Memphis, Tennessee, next to Graceland, Elvis Presley's place, because he was a big inventor as well. He invented rock and roll. That was also a revolutionary change in music. But yeah, and this hospital is also fantastic because I could be together with the children with cancer, and also with Nobel Prize winner scientists, very inspirational. So we discussed at lunch who will do what in the afternoon. So, and there was also really a pressure on me there too, to give an answer to these children, and immediately to reply, to tell them what kind of research I'm working on and why it's gonna help them. So, and then I came back to Budapest in 2003, which was the year of the human genome. And so by that time, we knew that cancers are heterogeneous at the level of the molecular alteration. So the same cancer can be caused by multiple different mutations, but the symptom can be the same. We always, be in the medicine, we always treat diseases based on the symptom first. We say yellow fever, black death, and AIDS, which is an acquired immune deficiency syndrome, which is caused by HIV. But first, we don't know why the disease, what's the cause of the disease. But when we find the cause, we usually find the cure in a very short time. So that's why COVID is, I think we will conquer COVID because we know the cause. So we are hunting already with drugs and vaccines. So it's because we know what's the sin behind the symptom. So again, with cancer is the same. This is the same journey, that we have to identify the molecular genetic causes of cancer and develop drugs against the causes, not the symptom, which is chemotherapy. But that time we realized that each cancer is caused by multiple different types of genetic alterations. So if we want to use these targeted therapies, we have to develop methods to identify patients who specifically benefit from these targeted therapies, because if we just use it without any previous selection, they will have a very low success rate. So at that time, the first drug and target pair we were working on, it was the EGFR, epidermal growth factor receptor. Now with doctors, we like to use these abbreviations and foreign words just to seem to be smart, but actually it's quite easy, because epithelial cells, epidermal cells which cover us, all these cells have a gene which regulates their growth. So this is the epidermal growth factor receptor, which is on the cell surface of the cell, so the other cells can send a signal to give the instruction to the cell to grow. And it turned out that there was a drug against this gene, and it inhibited very well. So what we did, we developed an assay to detect mutations in this gene. And so when a patient walked into our clinic, we were able to detect a mutation in the gene of her lung cancer cells and propose the targeted therapy based on this information. And that was the first successful treatment of a lung cancer patient based on molecular information in 2003. We published in 2005. So at that time, we had the technology to detect patients who benefit from targeted therapy. And I presented that on many medical conferences. We had the peer-reviewed publications. And then I was just waiting for things to happen, and doctors just asked for the test, but it didn't happen. So because they thought it was scientifically very interesting, but it was really it didn't came into practice. So to change the clinical practice is extremely hard. So as you mentioned, our role model Semmelweis, who's really the big hero and also as our role model of a doctor who really fights for his right, and he was really fighting for with other doctors to make them understand that they should also save mothers who were treated by other doctors, not just by him, because he could have said, okay, I'm a super doctor, I have the best results on my ward, and that's enough, just come to me if you want to deliver a baby. No, he wanted to really, he was getting crazy by the idea that he knows why mothers die, and he just cannot persuade other doctors to understand. So this is the same with me. So that's why I went from the research lab and I concentrated on our startup company, Oncompass, and further developed the technology to do a very sensitive method to quickly diagnose this mutation in paraffin-embedded blocks. That was a problem we had to solve also technologically, that most patients have only a tiny biopsy from the lung cancer, and also it's fixed in formalin, so it deteriorates DNA, it's fragmented, so we have to get out of the information of fragmented DNA. So that was the first problem. And then we developed it further, and then in 2008, we switched to next generation sequencing. We pioneered the technology how to do a whole molecular X-ray of the cell, not just taking this or diagnosing these genes one by one, but to know everything. Like switching from a chest X-ray to CT or MRI, and the same thing. And by that time we learned that, and we know now that actually, just to fast forward the story, that last year in 2020 there was a series of huge papers published in Nature about the genetics of cancer based on a global research on cancer, where the thousands of cancers were sequenced for the whole genome. And now we know that we can identify the genetic cause of cancer in 95% of cancer patients. So that's huge. The humanity could reach, because it's not like, the beautiful thing about genome is that it's huge, but it has a end. So it's a DNA is 2 meters long. And it has 3 billion nucleotides. It's a lot, but not endless. And we have 25,000 genes. It's a lot, but still it's countable. And also out of these 25 genes, there are only 723, according to our knowledge, which regulate cell growth and cell death. And so mutations in these genes can cause cancer. Mutations in other genes cause other diseases, but in these genes, it's so simple. So you have a car, you have a brake system, you have a fuel system, and then you have problems to regulate your speed. Then this is where you try to check the parts, and there is countable parts you have to check. So the same thing, but the problem is that what we see is more like usually until now I imagine this as a car, but nowadays I'm switching my example or to chess. So the problem is that this is a chess cancer is playing with us with 723 figures, and each figure or piece in this chess game has its own rules how it moves. And the cancer is using typically 3-4 figures together and in a strategy, in a special strategy how it starts cancer. Now if it starts with a queen and we have a targeted therapy which hits the place where the queen is, we have an easy job to kill the tumor. And this is what we achieved in our first lung cancer patient. So we didn't know at that time how lucky we were to facing a cancer with a queen strategy. But later it turned out that most cancers have a combinations of other figures, like 2 peasants and 1 bastion and horse, and we have to figure out how to use our targeted therapies to give a chess or chessmate to the cancer. So when we were able to detect all mutations in cancer patients, we started to think, okay, oh shoot, what should we do with this information? How we will make a decision which therapy to use based on the individual combination of mutations of millions of possible mutations in these 723 genes. So this is where our next phase of development started.
Well, this is amazing. I mean, this actually reminds me, like talking about chess in that context, it's also like, years ago, when we had those important chess plays, like the best chess player versus the supercomputer. And, there was still time where the humans won, but now, 2003, I remember I was making websites back then, people didn't have smartphones and technology, computing power was not there. But exactly now when we have like supercomputers that can crunch anything, and you can even, deploy your AWS, Azure, or Google Cloud easily to do your own machine learning models, you can, design that algorithm that could, get over that human, not to say that human chess players are bad, but let's say if cancer is this kind of organic, like a human chess player, we can design an algorithm that could beat that, because, in mind, you can crunch all the possible moves ahead. And that's I think that's super fascinating.
Yes, thank you. Yeah, this is it. So in 97, it was the year. In 96, the Deep Blue was the first match between Kasparov and Deep Blue, and then Kasparov won in 96, and then 97, the Big Blue won. So so ever since, the computer has become even more powerful, of course, in magnitudes. So we just have to acknowledge that in this game, the machine is better, but we humans will have to tell them the algorithms and the goal, what do we want to achieve. And now what we can do is that we use the computer power against cancer, and that's the big promise. So this is where the human is super intelligent to use another artificial intelligence against a problem the human brain is not strong enough. And so this is our hope. So this is why we developed our method, or AI method, which is now more like a rule engine. Actually, it's more like a chess engine, which is not machine learning based. Now, because for machine learning, we just not only need a supercomputer, but we also need data to train. So, and that's very difficult, because this clinical data of cancer patients is too noisy, because there are so many factors, parameters which influence at the end whether a patient is benefit from a therapy or not. If you think about it, it's not just the genes in the cancer cell, but also other metabolic variations and behavior and other diseases the patient might have. And so it's extremely noisy. So we will, and so there's too many parameters. And inside the cell is also this, there are these millions of potential combinations of parameters. So mathematicians, scientists say that we would need millions of data points to really train a machine to figure out the right algorithms, but we don't want to wait until that time. So what we could do actually is to tell the machine the rules we already know. Because we have reasoning, so we have thousands of, so we can do a multiple reasoning type of machine, because we, in the scientific literature, we could find thousands of assertions or connections, and we could turn into algorithms. And so what's happening is in our system is the system compares the parameters of the patient to the parameters of the evidence which was used to make the connection, functional connection between two genes, and then it calculates a weight to this the connection, but there are thousands of those connections, and these are all calculated. So it calculates what is the drug which inhibits the most important targets, which are connected to the most important driver alterations in the cell. So to always maximize the chance that we block the cancer, like we give the chest meat, and that's all calculates in milliseconds. So, and this year we had a major milestone in this development, because we had a validation trial. So we put it on the test, like in 97, the Kasparov Deep Blue match, because we had this opportunity to do this together with Professor Tourneau's team in Paris, Institute Curie, because they conducted a clinical trial there in which they sequenced the tumor of cancer patients, and then and they chose therapies, humans, the molecular tumor board, against these mutations. So that was their choice. They decided to which targeted therapy they use against which mutation they found in their patients, and then they followed up, and they knew the results. So what we did, that they sent us the molecular profile data, molecular diagnostic test data of these patients. We uploaded to the system, and then asked the system whether the system would recommend the therapy or not. The oncologists used, and it turned out that patients who received drugs, which was also recommended by the AI, had a significantly better outcome than those who received therapies which were not recommended by the AI, and that difference between the two groups was statistically significant, also in the response rate and also in terms of progression-free survival. So the beauty of this study, we published in Nature Partner Journal Precision Oncology this year, that actually we were showing that the machine can improve treatment decisions in oncology compared to the current state of the art way to make decisions. Now, of course, the difference was very obvious. The humans match therapies to genes one by one, in pairs. So there is a list of genes, each is paired to a drug. But in reality, each gene is connected to multiple drugs, and each drug is linked to multiple genes in the same cell by multiple connections. And that was just too much for, of course, to the human to take into consideration. But the machine can do this, and so we are very excited, and we work together with the Institute Curie to further develop the technology, but I have to say that this is already registered decision support tool. It's already in use, so doctors can use it anywhere in the world to improve decisions and to select the best personalized targeted therapy for the patients.
Well, this is amazing, like in a way that, I think that's actually one of the challenges that we're having these days, that, there is so much information, so many choices. I mean, you even go to pharmacy sometimes, like, you have something simple, you have like 20 different drugs for common flu. And like, as a consumer, it's super hard to make that decision. And as you said, there are like, as the cancer can play multiple combinations at the time with 700 genes. I mean, can you imagine if you would need to go to, like currently we're on a cake session, you would go to a cafe where they have like 700 different cakes. Like you would become super frustrated in the end and probably would choose no cake at all. That, if the computer is like, selecting that top 5 or top 3 for you, it sounds definitely like a great assistance for medical professionals. But actually, I have also one question, maybe coming from considering from our audience, that it seems like, when you started the journey, you mentioned year 2003, when you came back to Budapest, it seems like this overnight success has been actually like 20 years of super hard work. And in our audience, we have number of early stage companies that have taken their first steps together with EIT Health risk program in few years time, or maybe are considering to apply one of the EIT Health programs in 2022. So do you have some maybe good words of wisdom that, I mean, I see that you are super energetic and like maybe you have been also super energetic for the 20 years doing it, but I think usually the first days are the hardest. I think also when, you probably had to convince those people back in 2003 that have been like really like, going like a David and Goliath, trying to explain this new technology when people even don't have, I don't know, probably that time it was when people didn't have mobile phones, not alone, smartphones or their personal websites. That maybe you have like some good suggestions how to, survive those first years. And if people are saying no and thinking you are crazy, how you kind of have that sanity to go on for the next years.
The first thing which came to my mind, I read somewhere, so I should know who to quote, but I like this saying that you should fall in love with the problem, not with the solution. And so it's I think it's a general advice that if you choose an important problem you want to solve, then this will give you the credit and also the energy and the credibility to fight. That they see that if you can really make the problem, to make people to understand the problem, then they see that your solution is solving that problem. So that I think the most important thing. And then this energy I have is coming from this feeling that the problem I want to solve is very important, and so that gives me the energy. But also this was, I think, the part of our success, that we always chose the methods and technology to solve the next problem in this goal to find personalized targeted therapy for our patients. And we have seen on the field failures because they the other side tried to use the technology they had to fit to a problem. Maybe it's not the best solution. So yeah, yes, and then also be connected with the problem very closely. So that was also lucky that as doctors, we saw the patients and the everyday need, the real problem the doctors have. So, but it can be applied to any other field that you should talk to people who actually is working on that field to really have an instant feedback what they really need as a new tool before you start to develop something. So I think these are the, and I think this is an agile. That's the very now this is the mainstream way to developing. You know, this there is this book, it's about this lean startup idea that you should go out with a minimal valuable product and test it and immediately get feedback and make the next step. Don't wait long before you get the feedback to your product, and you always be ready to change the concept, because if you just have an idea and then you push it through, the statistics say that your chance to be successful is around 5%. But if you start a company to solve a problem and you continuously adapt yourself to make a better and better solution, I mean, you have very, very good chance to be successful, to solve at least part of the problem, and then you create a value for society, which will be rewarded at the end. So that's my general advice, and I like this new concept. This is now called fancy way lean startup method and agile development.
Yeah, I mean, I think this is, sounds a good wrap that choose and focus on the problem, and I think, yeah, it was. I remember already that I think it creates this kind of good connection. Like you mentioned that you saw those children dying, then you selected how you could treat the children cancer, and when you were doing the research in the US, that you could also apply and test out those things with the subjects, because if you're designing a product without knowing who are the users for the problem that you have no relation to, that's super hard. Like you would lose the motivation. Maybe, yeah, you can keep it for 1 year, but definitely not 20 years. And then, of course, yeah, being flexible I think in 20 years, the technology has changed so much that, yeah, I think what I see in your pathway, that you started trying to do those, testing with a computer power which didn't exist, and now of course adapting to the supercomputing power that you can deploy your algorithms on. So
that's an amazing journey. So actually I'm 50 this year, and so it was 25 years ago when I graduated at university. More, it's like 95, and it's amazing now I also teach part-time. I teach at the universities, and to tell young doctors and scientists and biologists that at that time there were no targeted therapies at all. The human genome was not sequenced. Can you imagine that? And so I was, but even in 1998, I was sequencing genes by doing gels. So I was pouring big gels, and each nucleotide was labeled with a radioactive phosphor, and then we used a liner to read the sequence. It was just going down and seeing the little lines and then calling A, T, D, T, G, G, G. So this is how I started, and there were no targeted therapies. So actually, there's another point which made us successful. It just came to my mind now. The connection with the patients directly also. So we communicated to the society from right away. We got a lot of criticism also by the medical society for doing that. But I always thought that the patients and the society is our customer who is paying for our research. So they ordered us to do this research. So we researchers, we don't do research for ourselves to become professors and be in committees, because even if we work at an academic institute or a university, our salary is coming from the taxpayers' money. So we are responsible telling them what we are doing. so they must know that we are working on things which are useful for them, and they continuously have to see how we progress with our research, because otherwise they will not trust us even when we find a solution. That's another problem. So we obviously have to be transparent, and so from the beginning we were discussing our results with patients. And for example, in 1997 was the year when the first targeted therapy was approved in the world. It was the therapy trastuzumab against EGR2 I was just referring to. This was the first. And so this is a growth factor receptor, which is on the surface of breast cells, which regulates how many cells we have in the breast when the lady is preparing for breastfeeding. And so it's a very tightly regulated, beautiful process. And then in some patients, this gene is amplified, so there's an overproduction of this EGR2 protein, which drives the cell growth and this division and makes the tumor. Now, there was a biochemist at Genentech in California, Axel Ulrich from Germany, who actually developed this first therapy against this target. But Genentech was very skeptic, FDA was very skeptic, because they thought that with the targeted therapies, it would be impossible to cure or treat successfully a complex disease like cancer. So everybody was using chemotherapy. It was very difficult to make the first step from 0 to 1. There's another great book like this. So how to make the first step, how to make the first targeted therapy and show that it actually works. So actually, there was a debate whether to stop the whole development program. So, but it was in the news. So the breast cancer patients held a rally in front of Genentech, and one lady with breast cancer chained herself to the door. So it was, and so that was a huge public pressure on Genentech to continue the development of this drug. And this led to the approval of the drug, and the lady who chained herself to the door was actually treated with the trastuzumab, one of the first. And the legend says that she did very well on the drug and lived on it. So this is the story how we have to talk to be connected, and that's super important now, to also ask the opinion of patients what they really need. So even ASCO, the American Society of Clinical Oncology, started such programs to involve patients, organizations, and ask them, what do you really want? What kind of treatment? Because then it will drive the strategy of drug discovery. So that's early on was our part of the success, to be connected to those who we are working for. And I think we should do this all nowadays. It's super important. We all about the problems with communication between scientists, technology companies, and the general population, which leads to tragic things like skepticism about vaccinations and so on, despite of our. So even if now we have the tools, if patients don't trust it, then we are really in deep trouble. So that's why we have to communicate clearly our intentions, our goals, that's the problem. That's why I'm saying that identifying the problem is the most important, because if they know that what's your goal, they trust you. Because if I say, okay, I developed the best and artificial intelligence in the world and it's super clever, you start to be feeling that, oh, do I want this? Am I happy about this? What do you want with this? And so if I start telling the problem of the cancer chess, and then I tell, okay, I developed a program to solve this, then okay, you are okay with it. Of course. So you have to always start with the problem and then to tell the solution, and then everybody will trust you and invest in you and support you.
And I think this is reminding me a bit like, Google Maps, that, when you went to, beforehand, let's say, also the medical journey, you could be like going from clinic to clinic, taking like you said, one of your patients was having a pile of papers, trying to get care from clinic to clinic because, there is no good result. So it's the same like, navigating your car. If you don't have maps, you don't know what's the fastest route. But now you have Google Maps or Waze. You put like, you want from this destination, from this point, let's say I have a cancer, to the point like, I don't have a cancer anymore. Tell me what's the fastest route for me based on my location and my destination. Don't say me like, what's the average way of getting from Paris to Rome? Tell me like, what's the most direct route being in this address in Budapest to that address in other side of the Budapest, and like that, optimize on time, optimize on side effects, and tell me that. And this is
super interesting, and you can even tell your individual preferences. Do you want to use the highway or not? And the same thing with patients. So in personalized medicine, we also call it participatory medicine. So we also have to take into consideration the patient's preference. So because it's another parameter. Do they want to live longer but with a lot of side effects, or not? Or take a higher risk, but by aiming for a cure, so that was a difficult case in the case of that lady, that she had multiple liver mets because of the failure in her treatment. But then again, it was a very difficult thing that I tried to pursue her to take the risk of the operation, but that would have meant to remove most of her liver, with a high risk of death by surgery. So how do you discuss it with the patient to take this risk, and how to explain that what is on the other side? So it's very, very difficult. So I think AI will help doctors a lot, but also to save time for doctors, to give more time to doctors to actually talk to patients. So this is where they should use their extra time to be more empathic. Because AIs will help in our decisions, but not in the human connections.
Yeah, I think that's the biggest thing, like, because like the human connection, I think also like how we failed in some parts of Europe with COVID-19 was that, when you have the chief medical officer of the country or somebody, just forwarding the PDFs of scientific literature to the full population, most of the population, they don't have 5 PhD degrees. They don't understand those complicated medical things, put into the communication they understand, say like where we want to head to, and also like winning them over. I think like actually not only healthcare, but many other sectors as well. We have seen how, for example, the ride-hailing companies, there was this, let's say, fights with taxi companies or whatever. But when people saw like this is so much better, there is no way back. And like probably, even though medical field is super regulated with clinical trials, validations, and so on, in the end of the day, when people want to give a chance, like they have an option either to die or to try something new that maybe has 5% survival rate, it's better to take 5% surviving rather than 100% dying, right? So, and probably then the regulators one day will also follow with the rules to give those things to try. But talking about these shortest routes and thing, what do you think? I know you mentioned already, like, focus on the problem you like, and think about the next problem and be close to patients. If maybe soon we are wrapping up, what would be the good idea to have the shortest route for like a fresh graduate from one of the schools here in Europe that wants to do healthcare innovation, that if that person would like to fast track, what's your suggestion? I think also, like, I mean, I know that you are the core founder, but like, how on earth have managed you to put together the team to make it all through? And probably I can imagine that, you know, doing it alone versus with a team, you get to that destination much faster.
Yes, so yeah, I'm very lucky. I have an excellent team of scientists, many PhDs. I was able to recruit people from University of Heidelberg and with PhD and so on. So what I see is there is now flux of talents also from academic institutes to technology startups and biotechs, because there is a more and more need in young people, students and graduates to really to feel that they are working on a real problem and try to deliver a solution. So they want to feel that this is important. So it's very nice. I think it's this new generation. This is Epsilon and X, and they are very much believe in values, and they see companies as value creating organizations of people, and not like in the old capitalisms where the profit was the number one goal of a company. Now it's changing. Now it's the impact, and it's not just a fancy word but they are serious about this. They want to work for a company who really make an impact, and also deliver tangible, real solutions. And so I'm really happy that I see more and more people coming to us, and they choose to come to a biotech company rather than to an academic career. And yeah, so I think it's a good idea to choose a small, medium biotech company after university. It can be a parallel. It can be you can be a trainee and do a PhD program at the same time. But I think it's very inspiring if you work for a young startup, for example, in biotech.
Awesome. And I think you also probably, like, based on your success, I see that on your website, Oncompass Medicine. So if you're listening to us today and you want to join the team of István, I think you can go to oncompassmedicine.com and click on the career button to see all the available job offers that you could possibly join the team and be part of this journey to design these targeted treatments for helping people with cancer, which maybe could be yourself or your family members.
Absolutely. Thank you for mentioning. Yes, of course. I want to take this opportunity to tell everybody that, yes, we are very much interested in young talents, molecular biologies, cancer biologies, computational biologies, infobionics, and also engineers, computer engineers, computer scientists. Yes, we are looking for talents to work on the machine which will beat cancer. That's the aim. So the other inspirational film I recommend everybody who has not seen it yet is The Imitation Game. I don't know if you've seen it or watched it. It's about the Alan Turing journey, how he developed the first computer and used to break Enigma, the code in the Second World War, the Nazis' code. And I really love that film, how the soldier explains to the scientist, asking, do you know how many lives we lose because we cannot break the code? And the answer is 3 while I'm saying this sentence. So it's the same with cancer, that actually 20 people die every minute in the world. So while we have been talking right now.
For an hour, can you imagine the amount of people who have died just of this 1 hour of our session? Yeah.
Yeah, I mean, it's just a quick 1,200 people died. So 1,000 people died. So it gives you a sense of urgency. And so what we want is a machine which breaks the code of cancer. And now it's the time, because now we have molecular diagnostic methods to detect the signal of cancer. So we know the positions of the figures and the pieces. And then now it's time to figure the step. And we need a machine to help doctors to make the right move. So
that's amazing. Amazing, Istvan. So everybody watching us today, or a replay on YouTube or whatever channel you are watching the replay, oncompassmedicine.com and career section, you can join the team in order to beat the enigma, beat the cancer machine, to break that code, and hopefully in the future, cancer is just like a small scratch in the skin. You can put easily Band-Aid and recover without losing the life of your close ones or co-workers or anybody in your community. This has been super inspiring, and I thank you so much for joining. As a very last thing, I was just thinking, the session we have here is afternoon cake, and we don't, due to COVID-19, we are not meeting up. But what would be, in your opinion, the best cake to inspire more medical innovation? So what would be your secret recipe? Would you put some berries? What berries? Cheesecake, whatever cake that the audience could eat while watching the replay?
So I have a special cake I love most, which is easy to make and beats cancer, and keep the doctor away, because it's made of apple. And, because yes, we don't have time to talk about the role of nutrition and food in preventing cancer. But basically, what I love is you just you can make a cake of using just apple, and also so it's the raw seeds of crops, and then you put just hot water in it, and a drop of oil, and mashed apple, and you just squeeze it together, and then you just put it in the oven for an hour, and it bakes together, and no added sugar, just little cinnamon, and it's just delicious. And there is no added sugars. You don't feed your cancer cells, and stay healthy and be happy.
So that's, I think, perfect advice, especially considering the holidays are coming up, that if you're watching us from the US, you probably have a big Thanksgiving feast coming up, that, this is the recipe to probably beat your cancer. Or as soon you are probably celebrating Christmas, the Advents, lots of New Year parties and so on, that, sugar-free apple cake recipe from Istvan for you to try out.
Write to info at Oncompass if you want the exact recipe to make.
Awesome. So info at oncompassmedicine.com for
That's
you all listeners today to get also secret recipe to be innovative and healthy. But thank you so much again, Istvan, for joining us. Thank you everybody for listening this series of Afternoon Cake. And I hope you enjoyed this episode. If you did enjoy the episode, click on the like button. If you have any comments, you can reach out Istvan at info@oncompass.com, and probably they can also link you up on LinkedIn.
So LinkedIn, you can find me Istvan Petak and just connect me there. Also, it's also possible. Also, if you are a young talent and want to connect.
Awesome. So do you want to, whatever you want to do and you want to be part of this journey, reach out to Istvan, and that's a super great opportunity. But once again, thank you for joining us today, and see you soon again in a new episode. Thank you.